But first, we're joined now from central London by the Health Secretary, Matt Hancock, the man who's been at the heart of the government's response to the pandemic. So let's go straight to Matt Hancock, shall we? Now, thank you very much for being on the programme. Lots of questions that our viewers want to know the answers to this morning. You've said today in the Sunday Telegraph that our generation has never been tested like this and the UK must pull together like it did during the Second World War. Is this a crisis like we've never seen since World War II?
I think it is one of the biggest challenges that we've faced for a generation. We've been through worse as a country, of course we have, but it is a very significant challenge. You know, the measures that we're taking, the measures that we're looking at taking, are very, very significant, and they will disrupt the ordinary lives of almost everybody in the country in order to tackle this virus. And I think it is a big challenge as the country. You know, this is a national effort. Of course, we in government have got a huge weight of responsibility to get the response right. And the NHS has got an extraordinary time ahead of it, and I'm sure that it will rise to that challenge, but it won't be easy. But every single person can act. And I was on your programme a couple of weeks ago and saying everyone can act by washing their hands. We'll take the right action at the right time nationally, and we will be asking people to do more than that in order to prevent the spread of this disease. You know, our objective is to protect life, and that's why we're going to be taking some of the measures that we're taking, all set out in the action plan a couple of weeks ago. But the time is coming.
You say that the time has come, and certainly even in that space of just a couple of weeks, it does feel as if the situation we're in today has rapidly changed from, you know, just singing happy birthday while washing your hands, important though that is. What exactly are you asking people to do then? You're saying that you're going to be stepping up the response.
Well, don't forget that washing your hands is still the single most important thing that anybody could do. Everybody should be washing their hands more often. That slows the spread, it kills the virus, and it's incredibly important to wash your hands while singing happy birthday. So let's not forget that is absolutely central. But we also need to take steps to protect the vulnerable. And we set out in the plan how we would be prepared to do that and to advise the elderly and the vulnerable who are most at risk from this virus to protect themselves, to shield themselves by self-isolating. And we'll be setting out when that's necessary. We don't want to do that too soon, because if we do, it's clearly, you know, not an easy thing for people to do. It's not an easy thing for people to sustain. But the critical thing is we need to be ready, and everybody as a community needs to be ready to support the people who are being shielded for their own protection, the elderly and the vulnerable.
I'm keen to talk more about this shielding, because there'll be lots of people watching who'll be wanting to know exactly what this means in practice. So there are reports that the government is going to be asking people over the age of 70 to self-isolate, to stay at home for up to 4 months. Is that right?
Well, the answer to that is not yet, and the reason that we are not saying that yet is just because of this length of time that people would have to take that action to protect themselves.
But is it going to happen at some point?
Is very long. That is in the plan, yes, it's clearly in the action plan. The thing that we're saying today is that we need a national effort also to help prepare the NHS. So we've been working to buy as many ventilators as we can, because that's one of the critical things that's needed for people who are ill.
I'm keen to talk about that in a moment.
Today the Prime Minister is...
I'm keen to talk about that in a moment, but just to be crystal clear on the elderly, the government will be asking the over 70s to self-isolate, potentially for a period of months, at some point in the future.
That is in the action plan, yes, and we'll be setting it out with more detail when it's the right time to do so, because we absolutely appreciate that that is a very big ask of the elderly and the vulnerable, and it's for their own self-protection.
Are we talking about days, weeks away? How long are we talking?
Well, certainly in the coming weeks, absolutely.
OK, thank you. Now, I'm keen as well to talk about what you were just saying there about effectively asking British manufacturers to be put on a war footing, if you like, to turn their production lines over to start producing these ventilators. So how many ventilators do we have and how many do we need?
Well, we start with around 5,000 ventilators. We think we need many times more than that. And we're saying that if you produce a ventilator, then we will buy it. No number is too high. We're working with companies, we've been working with them for some time, both to buy ventilators that are available, but also to switch over production to ventilators and other critical equipment, like personal protection equipment, for instance. But the ventilators are the big thing. They are, they're relatively complicated pieces of kit. I couldn't make one, but they're not so complicated that the advanced manufacturing that this country is so good at now can't be able to turn its production lines over to. We've been talking to a whole host of companies about it, and the Prime Minister's hosting a conference call today with them to say very clearly to the nation's manufacturers, ventilators are the thing that we are going to need, and frankly, right across the world, the demand for them is incredibly high, so it is not possible to produce too many. So anybody who can should turn their production and their engineering minds over to the production of ventilators.
So we have 5,000 ventilators. Other countries have many times more. Can you guarantee that everybody who needs a ventilator will get one?
Well, that is absolutely the task, to reduce the spread of this virus and to build up the capacity in the NHS at the same time. It's not only the physical machines we need, we also need the trained people to use them, and we're currently retraining doctors into the use of ventilators, because
so
we're going to have to...
That's the frank truth of it, isn't it? We don't have enough ventilators.
Well, we need more, absolutely. I mean, we wouldn't be putting out this call if this wasn't the core piece of equipment that we need to help people through this virus. You know, as Health Secretary, my number one task is to protect lives. And we do that by protecting the vulnerable and protecting the NHS. And the thing that the NHS needs now, more than anything, is more ventilators. We've been buying as many as we can, but we need to produce more too, because it's clear that whilst we need more here too, so does everybody else across the world.
So we can't guarantee, can we, that everyone who needs a ventilator will get one?
Well, you've heard me say many times that we don't make guarantees in healthcare. This virus is clearly a huge challenge, and we're learning about it every day. So I don't make guarantees like that. What I will guarantee is we will do everything we possibly can to protect life and to keep people safe. But this is a very, very significant challenge. And you've seen in some other countries around the world where it hasn't gone well. Thankfully, so far, since the early days of the virus, the rate of increase here in the UK is lower than other European countries. That's because of the brilliant work of Public Health England and their contact tracing. It's also because we've been doing more testing than almost any other country in the world outside of China and South Korea and Italy, the major epicenters. And that testing capacity is expanding rapidly as well. In fact, there's another big industrial challenge which we're working on with industry, which is to get more tests, and in particular a test that can be done by the bedside rather than a test that has to go to the lab. Everybody around the world is crying out for that, and we've been working for several months now with testing companies to get that testing capability. So the response thus far has been an incredible amount of work, but has helped to slow the spread. But clearly this virus is a very, very significant problem, and so we're throwing everything at it.
There's talk about the government trying to pass emergency powers next week in Parliament so it can do more. For example, allowing police to detain infected people, forcing schools and nurseries to stay open. What are those emergency powers going to be?
Yes, we're going to set out the emergency powers on Tuesday and publish the bill on Thursday. I've been talking to John Ashworth, the Shadow Health Secretary, who I think's on the programme shortly, about what's in them. This is a cross-party approach. He's made some suggestions of other things that should be in there, which we've included, it includes a broad range of actions, all about preparing Britain and making sure that we're ready should we need to be.
Is the government going to be banning gatherings of over 500 people?
Well, clearly, as we set out in the action plan 2 weeks ago, we are absolutely ready to do that as necessary. There's a whole host of further steps. Well, we've got a COBRA meeting tomorrow. We will take these decisions at the right time, but I'm absolutely prepared to take actions like that if that's what's necessary. We've already seen many sporting events, for instance, being cancelled, and lots of these big gatherings being cancelled. The thing that really matters in terms of slowing the spread, the biggest things are washing your hands. If you're ill at all, cough or high temperature, then you should stay at home for 7 days. That is absolutely critical. And then the next steps, like the sort of the isolation for vulnerable people and older people that we talked about at the start, these are the really big things that slow the spread and save the lives. And things like the mass gatherings. Actually, you know, it doesn't really matter how big the gathering is. What matters is making sure that people who have the illness aren't spreading it and stay home.
Another thing that many people are worried about is the provision of food. You know, we've all seen those empty supermarket shelves where the pasta's gone, where the loo roll's gone. We've seen delays to online shopping. Retailers have written an open letter basically saying that buying more than is needed can sometimes mean others will be left without. I mean, this is quite alarming.
Yes.
Are you worried that the food supply might be at risk?
No. So one of the things that we are confident about is that the food supply will continue. Now, of course,
can you guarantee that?
Well, we're confident about it. What I can guarantee is that we'll work with the supermarkets to make sure that people get enough. And that, you know, I understand why people might be stocking up, but it is people have got to behave responsibly. I think the supermarkets are right to. Well, I think the supermarkets are right to write the letter calling on people to be responsible and to consider the impact that their stocking up might have on others. We, of course, stand ready to take further measures if that's necessary.
Now, I just want to talk a little bit about the government's response to this, because lots of our viewers will be seeing schools closing in Ireland, they'll be seeing shops and pubs closing in France, they'll be seeing the US imposing travel bans, and we're not doing this. And they'll be thinking, why is the UK government so sure that we're right here and all the other countries are wrong?
Well, each country is taking measures according to their own circumstances. We're similar to many countries. For instance, we're very similar to the approach being taken in Germany and Australia and others. It's about making sure you do the right thing at the right time. We're prepared to take, if we need to, all the sorts of measures that you discuss, but we will do it based on the science. Of course, there's a lively debate about what's the best course of action. The scientific evidence is absolutely critical in underpinning our response. You know, we want to have the very best response in the world. Thankfully, so far, we have managed to keep the growth of this virus here slower than in other European countries. But we will absolutely take the measures that we think are needed at the right time, based on the best scientific advice.
You say that it's based on the best scientific advice. So why don't you transparently publish that advice and the government's modelling? Because at the minute, we don't know how many people are in hospital or in critical care. We don't know the information about how many people are picking up the virus in the UK rather than abroad. We don't fully understand the science behind your approach. We've been talking about herd immunity for a week, and today you say that's not part of the strategy. If you're so convinced that this is following the science, Why don't you publish it so that people can take it on their own knowledge rather than just on trust?
Yes, we're going to do that in the coming days. I think that's really important. I agree with you. The overall
So why
approach
hasn't it happened
in
yet
the
already?
plan, well, because our scientists are extremely busy and we're working incredibly hard. So, but we'll do that in the next couple of days. The overall plan is based on the science and based on transparency. Again, our response is one of the most transparent in the world. We published the plan right at the start to explain the sorts of actions we might have to take. And I remember when we published it and when I talked about it on this programme, there was quite a lot of surprise at saying we could do these measures, but we won't do them now. In terms of the number of people affected, we are fully transparent about that, and in fact now have a website where you can interrogate all of that data, because the best science is done in the open so that people can challenge and ask questions and make suggestions. You know, I'd rather have 100 suggestions, even if only one of them is something new that we hadn't thought of. The goal here is to get the very best response for the UK, you know, the challenge and the debate in public, I think, is a good thing to try to get the very best response. After all, this is something that the whole country needs to do, because the whole country is going to have to go through this.
And it is being up for debate now. Your approach is being challenged. We've had this letter from hundreds of scientists claiming the government is risking many more lives than necessary by not implementing immediate social distancing measures. Richard Horton, the editor of The Lancet, for example, the medical journal, saying the UK government, Matt Hancock and Boris Johnson claim they are following the science, but that is not true. The evidence is clear. We need urgent implementation of social distancing and closure policies. The government is playing roulette with the public. This is a major error. Are you playing roulette?
No, obviously, and you know, you've got. I'm not going to go into responding to that particular accusation. What we'll do is listen to all of the credible scientists, and we'll look at all of the evidence, and we'll listen to also all the politicians who are making points about the judgments that we make. But what we will not do is deviate from having a plan that is based on the very best scientific advice, and that's important. I saw the letter. The letter was saying that a goal of herd immunity is the wrong thing to do. Herd immunity is not our goal or policy. It's a scientific concept. Our policy is to protect lives and to beat this virus.
OK, Matthew Hancock, thank you very much for coming on the programme today, explaining the government's response to coronavirus. Much appreciated.
Good to be with you.